Welcome to the American Indian and Alaska Native Behavioral Health webinar series, presented by the National American Indian and Alaska Native Addiction Technology Transfer Center. I am Kate Trams, and I will be administering today's webinar. Today, Erin Bailey and Josie Rafaelito will be presenting Bereavement and Grief. What are the resources related to Native American youth? This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. The National American Indian and Alaska Native ATTC is one of 4 national focus centers which serves the ATTC network. The ATTC network is a nationwide network made up of 10 regional centers, 4 national focus centers, and a network coordinating office. The map on this slide shows the locations of 4 national focus center ATTCs. To learn more about our center, the network, or your regional center, please visit our website. Our next webinar in this series is scheduled for Wednesday, February 5 from 1 to 2 p.m. Eastern Time, when Spiro Manson, Distinguished Professor and Director of the Center for American Indian and Alaska Native Health at the University of Colorado, Denver, will present Bridging the Gaps in Culture and Geography, Telehealth with American Indian Communities. In addition to this webinar series, we offer another series titled the Essential Substance Abuse Skills Webinar Series, which provides an overview of competencies from CSAT's TAP 21 publication, Addiction Counseling Competencies. The next session for this series will be held on January 22 from 1 to 2:30 Eastern Time, when Ken Winters, Professor of Psychiatry at the University of Minnesota Medical School, will present The Science of Addiction, the Brain on Adolescence. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs. The cost is $10 to do so. The CEH request form is available for download in the Files pod in the webinar screen. If you choose to download a file, a new tab will be opened in your browser, and you will have to click on the webinar window to return to view the webinar. If you are unable to download the documents from the webinar, please contact me using the information on the slide. Immediately following today's webinar, you will be redirected to our GIPRA evaluation. We invite you to participate in this brief online customer survey. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. GIPRA stands for the Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. SAMHSA uses information collected by these surveys to determine how many people have attended our events, your satisfaction with our events, and how useful our events are to you. We hope you will assist us in gathering information about our services by participating in this survey. Before we start today's session, I'd like to go over a few instructions for the Connect system. To view the presentation in full screen mode, click on the full screen button at the top right corner of the presentation pod. To return to the regular view, click the button again. You will be muted for the duration of this webinar. Please use the Q&A pod to share your questions and comments. Your questions will only be visible to me, the webinar moderator. I will pass your questions along to the presenter at appropriate points in the presentation. There are options for providing feedback for the webinar by using the attendee menu, which is on the upper left of your webinar screen and is signified by a figure raising their hand. Please feel free to submit feedback for the webinar using these options. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEHs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. Today's webinar is presented by Erin Bailey and Josie Rafaelito. Ms. Bailey is Director of the Center for Native American Youth at the Aspen Institute, where Ms. Rafaelito also works as a program associate. Both have had a significant impact in the behavioral health community for the improvement of services and in suicide prevention in Indian country. Please join me in welcoming them as they share their unique insights on bereavement and grief among the Native American youth.
Everyone, it's a pleasure to be with all of you this afternoon. I went through the participant list here and see many familiar faces or names, so thank you so much, and thank you to Kate for the introduction. This is a incredible webinar effort. We're delighted to be participating along with experts like Dr. Spiro Manson and others. So thank you to the National American Indian and Alaska Native Addiction Technical Transfer Center for giving us this opportunity to really share more about the Center for Native American Youth and specific work we're doing around grief and bereavement. We look forward to hearing questions from you and discussion, and look forward to staying in touch with you, learning more about your work. We really consider this as a first step in sharing with you a little bit about what we do and hoping to learn more about your work and how it overlaps with bereavement and grief services in Indian country. In terms of introductions, as Kate said, I serve as the director of the Center for Native American Youth. I formerly worked as a health policy advisor of the Senate Committee on Indian Affairs, and we'll talk a little bit just in terms of background on the center and how I transitioned from that role. But in that position, I was the lead staffer in the Indian Healthcare Improvement Act and a series of field hearings around youth issues and especially youth suicide prevention and law enforcement, social services. And with that, I want to turn it over and allow my inspiring and esteemed colleague Josie Raffalito to introduce herself before we get started.
Hello everyone, Yate. My name is Josie Raffalito and I'm one of our program associates here at the Center for Native American Youth. I'm originally from Pine Hill, New Mexico, and my background is in public health, where I studied a lot of behavioral health issues as they relate to not just Native American youth, but the American Indian and Alaska Native population at large. So we're really excited about being invited to participate in this webinar series and look forward to having this discussion and being able to answer some great questions at the end too. So thank you for having us.
So in terms of what we want to cover today, we just did brief introductions. We are going to give you just a little bit of background on the Center for Native American Youth. It's a relatively new organization, so I want to provide that information to you and then describe a specific project that we've been working on with the New York Life Foundation, talk about the phases of that project, the themes that we've discovered, outcomes, and our next steps. And again, we're going to leave time for questions or discussion as much as possible at the end. And also we are going to share some communications efforts that we have ongoing and hope, again, to stay in touch with you. So what is the Center for Native American Youth? Well, this is an organization dedicated to improving the health, safety, and overall well-being of Native American youth through communication, policy development, and advocacy. The center was created by former Senator Byron Dorgan from North Dakota. I see some familiar faces from that region of the country in the participant list, but Senator Dorgan served in statewide elected office for over 40 years, and his true passion is suicide prevention in Indian country. And I know in the fields that you're working on and that the Transfer Center works on, that there is, you all have a lot of expertise in this area. But as you could see from our mission, we are much broader than just talking about youth suicide in a box. We really believed that in order to make an impact on that issue and to be successful in national policy advocacy work, we needed to be talking about many other issues that you all are working on: substance abuse, housing, juvenile justice, education, etc. So we're placed as a policy program at the Aspen Institute in Washington, D.C., an entity that's really known for elevating issues into the national dialogue and drawing more attention and more resources, new faces to this advocacy and education work. We also have our own board of advisors, just to highlight a few that may be of interest to you. We have policy makers such as Senator Lisa Murkowski, former Senator Smith, former Senator Tom Daschle, 3 youth board members, and I didn't include this, but we also have a youth advisory board that's made up of a Champions for Change program, youth leaders from across the country that are doing inspiring work in substance abuse and education and mental health. And other Native experts and passionate youth advocates like Chairman Ernie Stevens and Patty Talahongva. If we were in person, I would give you prizes if you could name 3 people that you could recognize from this slide, but since we're not, you'll just have to imagine that I'm throwing a Center for Native American Youth Frisbee at you. So in terms of the issues that we focus on, I touched on this: health, education, juvenile justice, and child welfare. And this is really what our board has charged us to focus on, to, as I said, think about youth holistically and through an equity lens. That what Senator Dorgan, coming from his position as a policymaker, felt exasperated, I think, a lot of times about constantly needing to educate his colleagues and peers. I certainly felt that way during my time as a Senate staffer about why it's important that we make progress on these issues and why Native American kids, the youngest first Americans, should be first on the agenda. And so we really focus on that from our platform on a national level. Our work impact model really focuses in 4 areas: youth inspiration, advocacy, policy change, and building a resource platform. And at all levels, we've made our first priority reaching out to youth and communities to build meaningful relationships and channeling these relationships and to build connections and build a national policy and resource platform that can create kind of a convening point to push change forward. So why specific work on grief and bereavement, and how did we get to this project that we're going to talk about today? Well, we've really heard from young people themselves through our first 2 years of primarily focusing on listening to communities and listening to youth that this was an important area and a priority that youth wanted to see more work in. And we heard that directly from young people's voices, from tribal leaders, from community members, and we also, from data and a strong partnership with the National Indian Child Welfare Association on this project, knew that American Indian Alaska Native youth experience grief and bereavement at higher rates than their non-Native peers, that as a result of shared experiences by American Indian peoples of historical trauma, such as displacement and forced assimilation, loss of language and culture, that there's really a legacy of unresolved grief. One study I'll mention is that of 205 American Indian Alaska Native youth sampled, over 90% of them, 94.3% of them, reported that they had lost someone close to them. And almost a quarter of those youth had indicated that they'd lost a classmate or peer. And with high rates of suicide, recorded at 2.5 times the national average most recently, but as high as 10 times, I know, in some of the communities that you all are representing, and higher rates of death, that this is an area that more resources need to be given to help communities address this need. So for us, we believed that more work needed to be done to really advocate and connect people and organizations, to convene the current stakeholders and identify pressure points to make progress, to exchange resources and be able to really kind of diligently and almost obnoxiously share those resources with the tribal communities and those working on the ground, and then to engage youth directly to elevate their priorities on a national level.
Right, and so when Erin was describing our work and really, understanding that Senator Dorgan and our board and our whole team are really committed to, engaging tribal leaders and youth and parents and programs in Indian country in our work, we wanted to highlight that since we've launched now, we've held over 75 Native Youth Roundtables in over 17 states now, and this is really our way to, connect with young people directly and hear from them about, the diversity and complexity of issues that are, happening in their communities. And so these conversations have happened over the past almost 3 years now. And it was from these initial conversations and ongoing conversations that we started to understand that grief and loss and bereavement really were coming to the surface of the different issues that we were really talking about. And so when we are sitting down with young people and trying to have a conversation about bereavement and grief, a lot of the different issues that come into play are, the loss of a peer or a loved one due to suicide, the loss of an elder in the community, also connected to hopelessness and lack of connection to culture. And so kind of the bigger conversations and discussions around lack of connection to language and land in the larger community. So from what we started to understand is that, grief is, the loss of an individual or a family member or a friend, but it's also, a collective loss from the community as a whole. And so, it's through these outreach trips that we were able to better understand, how grief looks different with Native youth and how we can really be able to play a role in communicating what that looks like on a national level and with new funders. And so, we really want to make sure that we are engaging Native youth in this discussion and inviting our youth advisory board members to get involved. So the picture that you see right now is one of our champions for change and also one of our youth advisory board members, Vance Homegun. He's Salish from Arley, Montana. And when we reached out and asked the young people to share their thoughts on bereavement and grief, Vance was one of the first people to respond and, shared a message with us that we wanted to pass on to you today. So Vance was sharing that, the closeness among our people is powerful even today. It's a closeness I can't describe. All I could say, it is very special and very rich. Today, the young Indian people are witnessing their way of life, language, key leaders, and elders pass on. We need all the help and support we can get. So this is why specific resources and solutions targeting Native youth can be very comforting. He believes that bereavement and grief plays a crucial part in the healing process for many Indian people. And one of I think a really powerful quote that he left off was that, tears are a gift from the Creator, and it's a special way we can heal by letting the bad stuff come out. So it's definitely a voice and a message that we want to make sure that we continue to share, not just throughout this project, but also through the continued conversations about bereavement and grief with Native youth. So I guess the goal for the grief and bereavement
my microphone
project
was muted. I was so
Oh.
sorry, participants. So the overarching goal for our project was really twofold. First and foremost, to raise awareness and develop an understanding of the expertise that exists, where there are stakeholders that can be pulled together and elevate their voice. And second, to identify what resources are needed, where are there gaps, and find ways to expand and help communities, young people, tribal leaders execute work in this area according to their priorities and goals for what they believe works best for their young people. The specific objectives were, as I said, to better understand what grief, loss, and bereavement look like in Indian country, to discuss current resources and best practices for grief and bereavement available to youth in Indian country, and lastly, to explore potential strategies, collaboration, and outreach to expand programming for Native youth, tribal, and urban Indian communities. This project was funded by the New York Life Foundation, and a lot of credit is due to New York Life. They are the only national foundation that is really funding childhood grief, and we approached them about 2 years ago now and really said, we see all this great work you're doing. Many of you may have heard of Grief Reach, a program that reaches out to bereavement providers across the country. And so we said, well, what are you doing with Native American young people? How is this population included in their work? And again, a lot of credit should be given to them because they said, you know what, we're not really doing that much. We don't have targeted work and we probably should. And so how do we do that? And so we engaged a series of partners. And we're really going to go through these project phases here and what we learned. But I just want all of you to know that we're at a stage of finalizing a report that summarizes many of the pieces that we're talking about today, and working on potential next steps. And I'll touch on this a bit more a little bit later, but the result may be a new RFP and funding for tribal communities to do specific work in grief and bereavement.
So here's just a snapshot of our project overview, and we, like Erin said, we knew that this was going to be a first step in trying to gain a better understanding of what grief and bereavement really looks like in tribal communities and with Native youth, and making sure that we're engaging our existing partners and understanding what resources currently exist. So we're going to go through each of these components throughout the rest of the presentation, and we are open to questions and happy to answer things towards the end or when we have time. But we are going to start off talking a little bit about our literature review, and then go into talking about who we engaged and which partners we engaged, and our focus groups, and a survey we created, and key informant interviews, and then our final convening piece. And so with our literature review, we were really lucky, and I feel a little sad today that we don't have one of our key project leaders with us today. We had a graduate research assistant who helped with a lot of this project, and she did such a great job in pulling together some of the key literature to review and understand what currently exists out there, and what are the key resources for grief and bereavement, both Native and non-Native. And we just wanted to get a baseline understanding in the field of bereavement and grief. And so we did this literature review, and as you can see on our slide, it was really interesting to find out that with over 1 million publications identified for child bereavement and grief, there was a very small pool of articles that specifically talked about the American Indian and Alaska Native population. And even more, there were only 4 articles that specifically talked about Native youth as it relates to this issue. So, I mean, it was just it was really helpful because it helped us understand, what the conversation looks like generally, and who are what does the key research and data really look like, and really trying to I guess narrow in on where is their data lacking, what is missing, and where are there pieces of the puzzle that we need to have a better idea about to help move forward with the project and the conversations throughout the rest of the components of the project. And so I think it's really important to note, I guess, here in this research and literature review piece is that, one of the, I guess, the contributing factors that we identified as a sort of a barrier to the lack of available literature in this area is, the difference in vocabulary and terminology, and how grief and bereavement is described in Indian country and with tribes, and understanding that terminology may look very different. And so this was, I think, really helpful in the beginning stages of the project to help us, understand different ways that we can go about having these conversations with our partners and our Native youth generally. And so moving forward, we, throughout this project, we really wanted to make sure that we were finding what currently exists, what are those resources, who are the key players in this area, and we always want to make sure that we go back and connect with our existing partners. And so, we had initial conversations with Indian Health Service and the National Institute of Health, and all these other agencies or tribal organizations that you see listed, to first introduce them to the project and get their initial thoughts on, the direction we were going. And I mean, this was an incredibly helpful, second step to be connected with other stakeholders in this field, and to get suggestions or other ideas on I guess some upcoming projects or upcoming phases of the project. So it was really, really helpful to have their insight, to have them involved, and we absolutely looped back with them and, continue to connect with them and ask for other insight and ideas as this project came to an end and also continues, as Erin said. We also did our best in communicating the project with Indian country at large. We are, since Erin did mention that we are a new organization, and this project was very new for us as well. And so we wanted to make sure that we were being very honest and transparent with the steps that we were taking and the goals that we had in mind. And so we made sure that we reached out to tribal leaders to introduce the project, the steps we were taking, and we really wanted to open it up and ask tribal leaders to be involved in any way that they wanted to be. So if it was a follow-up call to learn more about the project, we had a few tribal leaders that stepped up and said, we would love to talk to you or share information about a specific program we have in our community that we think addresses this issue. And so it's just another way that we went to engage tribal leaders and tribal communities in this work. And so that again is just another way that we continue to build on our existing relationships and our partnerships in Indian country, and try to get people engaged in this project to make sure that we have a better understanding and a holistic view of what grief and bereavement looks like with Native youth and in tribal communities. So another big a big component for this project was putting together 2 focus groups, and we were really lucky in being able to partner with the National Indian Child Welfare Association to put together these 2 focus groups, and it fell into the time frame of their national conference in Tulsa this past year. And so it was a way to sit down with 19 child welfare service providers to hear from them about their perspectives on grief and bereavement with Native youth. What are some of the stories or perspectives they've heard from young people that they're providing services to? What do these resources look like in their communities? Can they connect that back to this issue specifically? And so this project, or this component of the project, was really helpful, and we were able to pull together some key themes that that we got out of these focus groups that were highlighted the need to make sure that we're partnering with funders in steps moving forward, and understanding, again, they reiterated that bereavement and grief may not be the vocabulary used in conversations around this issue, that it may be more of like healing and loss. A big highlight for us that we took away, and something that we continue to incorporate throughout the rest of the project, was really understanding the importance of tribal diversity, and if there are any solutions or strategies that are created moving forward in this project, that tribal diversity needs to be a big piece that we continue to revisit and understand and communicate in the steps moving forward. And then there's also another piece that I wanted to highlight is, and Erin touched on, is the importance of including conversations about historical and intergenerational trauma when we're talking about bereavement and grief. And so during these 2 focus groups, that was something that definitely was touched on a lot, and something that we heard loud and clear is an issue that needs to be included in the discussions. So those were our focus groups in Tulsa, but we also wanted to make sure that we were including these conversations in other outreach trips. And so, we participated in the United National Indian Tribal Youth Conference, one of the, I guess, the largest national Native youth organization that brings together Native youth leaders from across the country. And so this was a great platform for us to, connect with young leaders who are willing to share their thoughts and perspectives on this issue. We also connected with the National Congress of American Indians Youth Commission, and also we presented at the National Bereavement Camp Conference back in October to again introduce the project, what I guess lessons learned and key themes, and really making sure that we're being inclusive of the people that are brought to the table, and make sure that we include their ideas and thoughts and ideas on resources and strategies.
Gathering information from Indian country, we wanted to know who was serving, who could already be serving Native American youth, that there's a lot of programs, bereavement service providers across the country that are on or near reservations, in urban settings that may be serving Native American youth, and we wanted to try to get a picture of what that looked like. So, how many programs that are specifically aimed at bereavement are serving Native American kids, and what kind of work, what kind of low-hanging fruit, so to speak, exists in terms of these services that could be connected with tribal communities if tribal communities and tribal leaders and young people felt that that would be helpful. So to that extent, we partnered with the National Alliance of Grieving Children, Boys and Girls Clubs of America, and the Moyer Foundation. And we sent out a survey with the goal being to better understand what current services related to grief, bereavement, and loss were already available to Native American children. And we got responses from 76 existing programs across the country. The main takeaways were really that over half of these programs report not serving American Indian youth at all, or at least they don't think they are. They're not tracking it in some way, but they say they're not serving this population. That well over a quarter want to better serve Native American youth, but really don't have the staff or capacity or cultural sensitivity to know how to approach that or plan or strategize to do that work. And that almost half answered if an opportunity arose that their organization or program, as I said, would not be prepared to do this work. And so the big kind of summary for us of this was there's a lot of bereavement service providers that want to be building partnerships, and if communities and Native experts, mental health professionals felt that that would be beneficial to the communities that they were serving, that there was tremendous potential to build those relationships. Another phase we wanted to highlight was key informant interviews. We coupled the project with these key informant interviews really because we know that many of you, probably some of you on the phone, are experts, and we had a goal of wanting to confirm and clarify the needs and resources and possible strategies that we were hearing from young people, to be able to draw out and clarify these themes to make sure that we were not leaving behind experts that were doing this work on a community, regional, national level, ensure that their voice was a part of the project. And so just in terms of what we learned from these conversations, we learned that it's really important from the perspective of many Native experts working in this area to capture information on tribally driven initiatives, to advocate for program flexibility and incorporate cultural components. And I'll just pause on that one for a second to say that this is something we've really gone back to New York Life Foundation and other national non-Native specific partners here to say, this is a really important theme that we need to push on to understand the diversity of culture, and that programs need flexibility. They need frameworks rather than specific instructions for what has to happen. That it's important to account for the diversity of grieving practices for tribes, and that one model will not fit all. And we receive feedback on ask specific questions on the 5 developing recommended strategies and next steps. And the culmination of all the pieces of this project was a convening we did in October of this past year. It was facilitated by Sarah Kostelik of the National Indian Child Welfare Association, who, as we said, was an incredible partner on this. And we had 31 participants. The federal agencies are in parentheses there because it happened to unfortunately fall in the middle of the shutdown. So although we had a lot of excitement and conversations with Fed partners leading up to this, they were not able to attend on the exact day of the event. But we had Native youth participants. We flew in community level youth as well as parents, people that were running suicide prevention, grief programs, even if maybe they didn't use that specific word on the ground. And then had national tribal organizations and coupled that with non-native grief programs. So all three of the programs that we mentioned from the survey, the National Alliance of Grieving Children, Boys and Girls Club of America, and the Moyer Foundation were all included in the convening. And this was really to develop inclusive and achievable strategies and next steps for how to expand grief and bereavement resources for American Indian youth. So what have we learned? Let's take everything that we've learned, clarify those themes, and in some cases, we confirmed recommendations and strategies. In other cases, we got some really helpful feedback in terms of tweaking those recommendations and clarifying back to the funder and to other partners that have the potential to expand resources in communities what exactly we had heard. And then we also developed a matrix of responsibility, I call it, which is listing out for feds, for tribal leaders, for schools, for young people themselves, and several constituencies, what is each of their roles in this area, that we can't, too much work in progress came out of this project that we didn't want to just depend on recommending what a private funder needs to do, but what can the rest of these constituencies do to really help improve access to bereavement and grief services in Indian country. So the themes that came out of the project, now to the meat and potatoes, that bereavement and grief can be viewed as a result of historical and intergenerational trauma. And as Josie talked about, that oftentimes kind of the gap in terms of non-native specific programs and experts and funders is that there's a difference in sort of how you define and think about grief and the vocabulary, that it's very important to think about sensitivity of diversity. We met with particular communities, even within the same tribe, who had very different practices in terms of how you talk about death, and that needed to be something that was very communicated on a national level to policymakers and funders, and something that was we held in our heart as a theme of our work. That sustainability and capacity building is a challenge. I think that's probably not a shocker to any of you. That there's a need for more school and age appropriate resources. We actually had a fair amount of engagement from the education side of folks, and they really pushed us on this. We heard from teachers and educators that educators in schools are really looking for resources. They're on the front lines working with youth, and they need more tools. That holistic approaches to trauma, grief, and bereavement and resiliency are very important. One of the things we heard a lot that's documented from our focus groups and outreach was that oftentimes communities are really looking for funding for food or for a ceremony, rather than just have an expert peer-to-peer therapeutic session or something like that. And that there's a lack of connections to resources, that there are funding and programs that are out there, and oftentimes communities actually do want to be plugged into them, but there's a challenge in identifying those connections and finding out how to build those relationships. So I'll just pause for a second and say that we jumped in here quick to fill a webinar slot in January. So if I had the opportunity to change the slide now, I think I would change the title of this slide to Strategies with Traction. So what were the 5 things that we really heard coming out of the culmination, the convening, and what are things that we've worked with in our with experts in terms of potential strategies that would help improve services. So first and foremost, culturally appropriate resource materials. And this isn't just New York Life and other grief providers and organizations have tremendous amount of research and information available on specifics around bereavement. What is it? What do you do? How do you treat it? None of it has really been culturally tailored to any group. Military families to a certain extent, but obviously we're working with a much different situation, history, and population here. And the feedback we really heard was that 101 toolkits could be helpful, but that in any of these resource materials, it would be necessary that it be more of a framework rather than a detailed document that it allowed tribal communities to plug in their specific culturally appropriate pieces. The second strategy was around development of peer-to-peer trainings for youth and school-based approaches. We heard this from young people over and over and over again that, and this is no surprise to any of you, but that youth talk to each other. They're not necessarily going to a mental health provider. In many cases, the mental health services are quite limited. And so they're talking to each other, and youth are really grappling with and looking for training to help figure out how to respond to their peers, how to deal with their own grief. Third, that there are existing cultural camps, bereavement camps. We heard that the term bereavement camps is not one that Native experts want to use, but we listed it here as is just because it's the term that there are several existing large national bereavement camp networks, and they use that terminology, and there's certainly traction from those existing camps to provide scholarships and other opportunities to allow Native students to be a part of that. So if any of you are interested in learning about existing programs, camps obviously have advantages and disadvantages, but there are resources available to plug in families and young people to that. And that there's obviously a lack of research. And our partner in NICWA said during this project, we really have an obligation, if there is this dearth of research, to find more resources to expand that work. And so that's something that we really believe more needs to be done. And then lastly, targeted funding for tribal communities. And as I said earlier, we're working towards a next step and potential RFP to allow additional funding or facilitate additional funding from the New York Life Foundation to communities to really think about and develop their own strategies to address this. And the reason that we are moving in that direction is that it could allow communities to do any of these other top 4 strategies that I talked about. And the details of the RFP are still in the works, not finalized, but that it could allow the flexibility to create a peer-to-peer program or send young people to existing efforts or provide culturally appropriate training to bereavement providers near a reservation if a tribe decided they wanted to partner with them, etc. And the last thing, I wanted to leave a few minutes here at the end for questions and discussion, but I do want to also mention that we have data fact sheets from this. Josie and I both kind of rattled off a few statistics pretty quickly, but we really felt an obligation as a part of this work to share what we had learned. So we're finalizing the report and summaries from focus groups and outreach to young people, which there will most certainly be a public version very soon in the next month. But there's also just data summary sheets. And if any of that would be useful, please contact us. And I will skip ahead just for a second so you all can see some ways to stay connected with us.
Right, and so we really, like Erin said, we want to be able to share information about resources or updates about our work and, directly related to bereavement and grief, what are going to be these next steps in the project. And so ways that we're going to be communicating about that is through, we have an online blog on our website at CNAY.org or CenterForNativeAmericanYouth.org. We have a monthly newsletter that, again, shares resources and updates about what we're doing. And then we also have a weekly email that goes out. It's called Native Opportunities Weekly, that shares information about any type of camp or internship or scholarship or any other opportunity for a young person, as a way to, again, just really be obnoxious in the way that we're sharing these resources. We're also very active on our social media accounts. We have a Twitter account, we're on Facebook, we have a YouTube channel. So we're constantly blasting out information, and again, we're sending out updates and other resources through our tribal leader letters. So we would absolutely invite you to be involved, visit our website, sign up to receive the newsletters or the Native Opportunities Weekly. And then we also have our email and phone numbers listed here too, because we would be open to discussing the project more, answering any other questions that we're not able to get to today. So I guess with that, we'll have a chance to open it up for discussion and answer some questions.
Great, thank you so much, Erin and Josie, for that wonderful presentation. And yeah, I will just remind everyone at this time, let me get to our just information on using the Q&A pod. You'll see an image here. If you have your full screen open, you'll want to click that full screen button again so you can view the question pod and type in your questions there. And yeah, we don't have any at the moment, so get them in and we will try to have time for any questions that come in. Okay, I have a question here from one of our attendees. The question is, are there any national funders interested in your work? So either Erin or Josie would like to take that question.
I can chime in here. So thanks for the question, John. So this specific bereavement project was funded by the New York Life Foundation. Like I said, they're the only real national foundation that's funding childhood bereavement. For us, this was a more specific topic-oriented project. Much of our work, as I talked about at the beginning, is much more general in terms of equity, education, and policy advocacy. Communications efforts. And so this project has been specifically funded by that foundation. We have a very close working relationship with them. We feel strongly that we may be the right organization on a national level to help build some of these connections, raise awareness, advocate, and draw more attention, but that the resources, our goal is really to drop money out of airplanes. So can we hook and advocate directly to funders to create new funding opportunities for communities directly? So on this project specifically, I would say that the New York Life Foundation is also working very hard to identify and attract other funders to this space. I think they kind of feel like foundations often do, that they're really the primary funder, and they want more people to understand the importance of working on grief. And so that's a existing effort with them. In terms of our work more generally, yeah, we have other foundations that support other aspects of our work. So I hope that answers your question.
Great, and we have another question from Kristen. She asks, could you please repeat what you said about the feedback received regarding toolkits?
Yeah, so thanks for the question, Kristen. I have a tendency to talk very fast and always talk this fast, so I apologize. So we heard I almost mixed messages on this in terms of the first phases of our project and then the end convening. I think on a community level, from youth throughout the earlier phases of our project, we heard that when we brought materials that were done on bereavement and grief for children in the general population on the community level, people that we met with, Native suicide prevention programs, for example, or things like that, were very interested in that material and felt like they didn't have the training or had access to some of this expertise that was compiled in materials before. And so in the early pieces, we really felt like, well, maybe this is an area where we need to think about an organization that could work with the organizations that have created these materials to make them more culturally appropriate. And then once we pulled together experts and youth and that diverse group of stakeholders at the convening, like I said, we really had pretty strong feedback, I would say, and Josie can jump in here and correct me, but that too much of the time resources are paid to developing quote unquote culturally appropriate material. And in the case of sensitive topics like grief and death and bereavement, that what might be culturally appropriate for one tribe is certainly not culturally appropriate for another. And so in terms of bang for your buck or initial investments, that if toolkits or something like that were to be the recommendation, that they be a framework rather than a specific detailed one culturally appropriate bereavement packet for Native Americans, that instead it be, here are sort of the overarching statistics, needs, the issue that you need to know as someone that works around this issue in Indian country, but then allowing a lot of room for communities and cultures to plug in their own practices. I don't know if that makes sense, or if Josie, if there's anything else you want to add.
No, right. I think that's exactly what we had been hearing throughout this project, and really wanting to take into consideration cultural diversity, and not necessarily giving a step-by-step, but like Erin said, more of a framework for people to be able to plug in different pieces of culture that they think is going to be most appropriate and important to young people going through, that includes bereavement and grief issues. So we wanted to make sure that we continue to share that message as we talk about toolkits and what that actually looks like, with direct service providers, and what's going to be most helpful. So we're always open to, I guess, suggestions or ideas on what currently, or what other people have used, or what people have seen to be helpful with frameworks. So, if afterwards anyone wants to follow up and share ideas about that, we'd be open to it too.
Great. Sounds like looks like we have another question from Jennifer. She says, it sounds like you have done a lot of research. What recommendations or tools would you recommend for counselors?
I can jump in here for a second, and Erin, feel free to chime in, but we really did do a lot of research and really wanted to understand what currently exists. And it was, of course, the first thing that comes to my mind is the resources available through the New York Life Foundation and their child and grief programming. They have different pamphlets and toolkits and different resources available online that you can order and have available for schools or the community or different programs. But we're also collecting all the different resources that we found so far, and we're going to be making them available on our website later, and outlining them as more bereavement resources that we've captured. So I guess a few to name, Native Pride is something that is an organization that we've connected with, and they offer culture-based programs that talk about kind of prevention and wellness and leadership development for Native youth. And so, that's one that we'll definitely be including. So that's called Native Pride. We also have the Moyer Foundation that will be listed as well, that has, I guess, that funds different bereavement camps across the country. And so Erin talked about that a little bit earlier, and that's not Native specific, but I'm sorry?
As well as substance abuse camps. They have a camp called Mariposa. So for those of you that are working specifically on that issue, that's definitely a resource.
Mm-hmm. And then we also, connected with the Indian Country Child Trauma Center too. So these are resources that, again, don't have the word grief or bereavement in their names or their listings, but they definitely talk about the issue as in a more, I guess, kind of holistic view too.
And just to chime in here, there will be in our report, we'll specifically highlight those organizations and experts that have been identified throughout the process. In the short term, for you as a school counselor, we can point you in a number of different directions. There's a whole host of material on the New York Life Foundation's page. Their website is called achildingrief.org, and you can find information in terms of resources there. And feel free to get in touch with us. There's a lot of other information I could share. We have a partnership with the American Foundation for Suicide Prevention and can help get connected in with local networks for you there. And then for those of you, I'm sure most of you have heard of it, but there are other curriculums that exist for schools specifically, such as life skills or other curriculums that have been developed for Native students, culturally appropriate, tailored tools that you could utilize as a counselor.
Great. Yeah, thank you so much, Josie and Aaron, for answering those questions. I don't see any other questions at this time. If you want to if you still have one, feel free to submit one right now, and I'll just go through my final instructions, and if we have any other questions, we will take them. But if not, I will just move along. But for now, I will just let you know that we will be having a survey after this webinar, so please stay online as we close it out. You will be automatically redirected. It should pop up automatically, but if you have a pop-up blocker on your computer, then there will be a URL if you'd still like to take the survey. Please also watch your email inbox for a follow-up in which we will include a link to the recording for this webinar as well. And please just remember our upcoming webinar in this series, Bridging the Gaps in Culture and Geography, Telehealth with American Indian Communities on February 5th with Spiro Manson. And we also have an upcoming webinar in our Essential Substance Abuse Skills webinar series on January 22nd, when Ken Winters will be presenting on the science of addiction, the brain on adolescence. So if there are no more questions, then we thank you very much for your time and participating in this session today, and we hope you've enjoyed the presentation and look forward to hearing your feedback. So at this time, I will close out the webinar and you will be redirected to our survey.